Pleural effusion is a condition that happens when too much fluid collects in the pleural space, which is the area between the lungs and the chest wall. Normally, your lungs and chest wall are covered with two thin membranes known as the pleura. In healthy people, there is only a small amount of fluid between the two layers of the pleura to prevent friction and help the lungs glide smoothly against the chest wall as you breathe. In a healthy individual, this fluid is constantly produced and absorbed, maintaining a delicate balance. However, when this balance is disrupted and excess fluid builds up in this space, it can lead to discomfort, difficulty breathing, and may signal underlying health problem. Pleural effusion is also known as water on the lungs, and it's a relatively common condition. It can occur in individuals of all ages, but it's more common in older adults. It's estimated that about 1.5 million people in the United States alone develop pleural effusion annually. Types of pleural effusion. There are two main types of pleural effusion, transudative and exudative. The classification depends on the type of fluid accumulating and its underlying cause. Number 1. Transudative pleural effusion. This type happens when fluid leaks into the pleural space due to high pressure in blood vessels. This can happen if you have non-inflammatory conditions, such as heart failure or cirrhosis. The fluid that accumulates is usually clear and watery. For example, if someone has congestive heart failure, the heart doesn't pump blood efficiently, causing fluid to back up into the lungs and pleural space. Number 2. Exudative pleural effusion. This type occurs when there's inflammation in the pleura, often due to infections, cancers, or diseases like tuberculosis or pneumonia. The fluid is more protein-rich and may contain cells, bacteria, or other materials. For instance, someone with lung cancer might develop an exudative pleural effusion as the cancer affects the pleural tissues. Causes of pleural effusion. Several different health conditions can cause pleural effusion, and identifying the underlying cause is crucial for treatment. Number 1. Congestive heart failure. One of the most common causes of pleural effusion is congestive heart failure. When the heart is unable to pump blood effectively, fluid backs up in various parts of the body, including the lungs. This leads to a transudative pleural effusion. People with heart failure often experience pleural effusion in both lungs. Number 2. Lung infections. Pneumonia and tuberculosis are common causes of exudative pleural effusions. When the lungs become infected, they inflame, and the pleura produces excess fluid in response to this inflammation. In the case of tuberculosis, a bacterial infection spreads to the pleura, causing a specific type of exudative effusion known as tuberculous pleuritis. Number 3. Cirrhosis. Cirrhosis, or chronic liver disease, can lead to a transudative pleural effusion due to a buildup of fluid in the abdomen, which is a condition known as ascites. This fluid in the abdomen can then move into the pleural space and cause transudative pleural effusion. Number 4. Cancer. Pleural effusion is a common complication in people with cancer, especially lung cancer, breast cancer, and lymphoma. The cancer can either spread to the pleura, causing inflammation and fluid buildup, or block lymphatic vessels, preventing normal drainage of fluid. Certain medications, particularly some used in cancer treatment, can also cause pleural effusions as a side effect. Examples of these medications include methotrexate, phenytoin, or amiodarone. Number 5. Pulmonary embolism. A pulmonary embolism occurs when a blood clot blocks an artery in the lungs. This can lead to an exudative pleural effusion as the lungs become inflamed, or it may cause a transudative effusion in some cases. Finally, in some cases, pleural effusion can result from injury or trauma to the chest. This can include surgical procedures, rib fractures, or other types of chest trauma. Symptoms of pleural effusion. The severity of symptoms can vary depending on the amount of fluid present and the underlying cause. In some cases, particularly when the effusion is small, there may be no noticeable symptoms. However, as the fluid accumulates, symptoms typically develop and worsen. One of the most common symptoms is shortness of breath. This occurs because the excess fluid in the pleural space restricts the lungs' ability to fully expand during breathing. People with pleural effusion often describe feeling like they can't take a deep breath, and this sensation may worsen when lying down. Chest pain is another frequent symptom. This pain is often described as a sharp or stabbing sensation that worsens with deep breathing or coughing. The pain may be localized to one area of the chest or may be more diffuse. A persistent cough is also common in people with pleural effusion. This cough is often dry and non-productive, meaning it doesn't produce mucus. In some cases, the cough may worsen when changing positions. Some individuals with pleural effusion may experience fever, particularly if the effusion is due to an infection. Fatigue and weakness are also common, partly due to the increased effort required for breathing. In severe cases, or when the effusion has been present for a long time, people may notice a decreased ability to exercise or perform daily activities. They may become easily winded with minimal exertion. Diagnosis of pleural effusion. When a patient presents with symptoms suggestive of pleural effusion, a doctor will start with a thorough physical examination. During the exam, the doctor will listen to the patient's lungs with a stethoscope. In areas where there's fluid accumulation, breath sounds may be decreased or absent. The doctor may also perform percussion, which is gently tapping on the chest wall. Areas with fluid will produce a dull sound compared to the normal, hollow sound of healthy lung tissue. A chest X-ray is often the first imaging test performed. On an X-ray, pleural effusion typically appears as a white area at the base of the lung. However, small effusions may not be visible on a standard X-ray. For more detailed imaging, a computed tomography scan may be ordered, as CT scans can detect smaller effusions. In many cases, a thoracentesis is performed to confirm the diagnosis and analyze the fluid. During thoracentesis, a needle is inserted into the pleural space to drain fluid. The fluid is then analyzed in a lab to determine its type, transudative or exudative, and to identify any infectious organisms or cancer cells. If the doctor suspects cancer, a pleural biopsy may be performed to examine the pleural tissue for cancer cells. Treatment for pleural effusion. The treatment of pleural effusion depends on the underlying cause and the severity of symptoms. Common treatments include: number 1, thoracentesis. Thoracentesis is not just a diagnostic tool, but also can be used as treatment. This involves inserting a needle into the pleural space to drain a large amount of the fluid. It can provide immediate relief from symptoms, especially shortness of breath, and is also used to analyze the fluid for diagnosis. Number 2, chest tube drainage. In more severe cases, where there's a large amount of fluid or repeated pleural effusion, a chest tube may be inserted to drain the fluid continuously. Number 3, pleurodesis. This is a procedure in which a substance, such as talc, is introduced into the pleural space to cause inflammation and make the two layers of pleura stick together. The goal is to prevent fluid from building up again between them. Number 4, surgery. In rare cases, surgery may be necessary to treat pleural effusion, especially if it's caused by cancer or infections that don't respond to other treatments. This might involve removing part of the pleura pleurectomy or creating a permanent drainage route, pleuroperitoneal shunt. Other than these treatments, treating the underlying cause is crucial in managing pleural effusion. For example, if the effusion is due to heart failure, medications to improve heart function may be prescribed. If an infection is the cause, appropriate antibiotics will be administered. For malignant effusions, treatment may involve chemotherapy or other cancer treatments. While pleural effusion can be managed effectively with the right care, early diagnosis and treatment of the root cause are crucial in preventing complications, such as collapsed lungs or infections. Now, we want to hear from you. Have you or someone you know ever experienced pleural effusion? How was it treated, and what was your experience like? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.